to locate it and assess its depth and size. If you have an order for a topical anesthetic cream, apply it about an hour before you plan to access the VAP. If you don't have such an order, apply an ice pack for 1 to 2 minutes to numb the site. Open the sterile drape and access kit. Put on a mask and sterile gloves. Prepare the sterile field and place your sterile supplies on it. Attach a 10 milliliter syringe of sterile saline solution to the extension set of the non-coring needle. Inject the saline solution into the extension set, purging all air from the tubing and needle. Clamp the tubing. Place a sterile drape below the prep site. Clean the site with an alcohol swab, starting over the VAP and moving outward in a circular pattern until you've cleaned an area about 3 inches in diameter. Repeat this step with 2 more alcohol swabs. Now clean the site in the same manner with 3 povidone iodine swabs. Without touching the access site, pat any excess povidone iodine with sterile gauze. Now stabilize the reservoir between the thumb and forefinger of your non-dominant hand. Hold the non-coring needle like a dart with your dominant hand and position it perpendicular to the septum. Now push the needle straight through the skin and septum until it hits the back of the reservoir. Unclamp the tubing and aspirate for a blood return. If you don't get a blood return, remove the needle and try again. When you do get a blood return, steadily inject 5 milliliters of the saline solution. Then clamp the extension tubing. Now attach your medication or injection cap. Apply a transparent semi-permeable dressing. Then attach a label that includes the date and time, the needle gauge and length, and your initials. Clean the cap with an alcohol swab and flush it with heparin according to your facility's policy. Change a non-coring needle at least every 7 days. To remove a needle from a VAP, first wash your hands and put on gloves. Flush the VAP with saline solution and heparin solution according to your facility's policy. Remove the dressing. Now use the thumb and forefinger of your non-dominant hand to stabilize the VAP. Remove the needle with your dominant hand by pulling up and out. Caring for central venous access devices safely and effectively can help prevent complications and can help you quickly detect any complications that do occur. Meticulous catheter care also helps your patient's device remain functional for as long as possible. Routine care of a central venous access device includes flushing the catheter, properly infusing medications or fluids, changing the administration set, changing the dressing, changing the injection cap, and drawing blood. Naturally, you should follow your facility's policies when performing any of these tasks. Use safety needles or needleless systems whenever possible, and always wash your hands and wear gloves. You may need to flush a central venous access device before and after giving medications or fluids, after withdrawing blood, and routinely to maintain the patency of the catheter. Usually, you'll flush with twice the volume capacity of the catheter, although this volume varies with the type of catheter being used. Before flushing a catheter with heparin, double-check the manufacturer's recommendations and your facility's policy. If your patient has a PICC line, a non-tunneled catheter, or a tunneled catheter, you'll probably need to flush it once daily with normal saline solution and heparin solution. If your patient has a VAP that isn't being used, flush it once each month to prevent occlusion. Remember that Groshon catheters are flushed weekly with normal saline solution. To flush a catheter, prepare a 10 milliliter syringe with the appropriate amount of saline solution. Wipe the injection port with an alcohol swab. Attach the syringe to the catheter and flush the catheter. After flushing, keep positive pressure on the catheter by holding your thumb on the syringe plunger as you remove the syringe. This pressure prevents the backflow of blood, which could cause clotting in the line. After the saline flush, flush the catheter with heparin if indicated. Always use 10 milliliter syringes when flushing a central venous access device because smaller syringes exert greater pressure and could cause complications. If you need to give fluids or a medication through a central access device, begin by checking the doctor's order. Check to see if the patient has any allergies.
No.
Then prepare the appropriate administration set and explain the procedure to the patient. After flushing the device, you can then attach the administration set and infuse the ordered medication or fluid. If the patient has a continuous infusion in place, you'll need to change the administration set every 48 to 72 hours, according to your facility's policy. To change an administration set, first, prepare the new administration set. Clamp the tubing of the old administration set. Clamp the catheter. Remove the old administration set. Connect the new administration set using aseptic technique. And begin the infusion as ordered. You'll need to change the catheter dressing according to your facility's policy, usually every 48 hours for a gauze dressing or every 3 to 7 days for a transparent semi-permeable dressing. Also, change the dressing any time it gets soiled, loose, or wet. Remember that a tunneled catheter doesn't need a dressing after the cuff area heals. That happens in about 10 days. To change a dressing, follow these steps. Put on clean gloves, then inspect and palpate around the site. Hold the catheter with one hand while you pull the old dressing off with the other hand. Discard your gloves and the old dressing. Open the sterile dressing kit using aseptic technique. Then put on a mask and sterile gloves. Place a sterile drape below the insertion site. Clean gently around the catheter with an alcohol swab. Start at the catheter site and work outward in a circular pattern. Now clean the site in the same manner with 2 additional alcohol swabs and then with 3 povidone iodine swabs. Be sure to clean an area 3 inches in diameter. Without touching the site, pat any excess povidone iodine with sterile gauze. Then apply the new dressing. Place a label on the dressing that includes the date, time, and your initials. Change the injection cap every 7 days. To change an injection cap, make sure the catheter tubing is clamped. Remove the old cap and quickly connect the new one. Flush the catheter with saline solution and, if needed, with heparin solution. Clamp the catheter. One advantage of central venous access devices is that you can obtain blood samples without repeated venipunctures. To obtain a blood sample, follow these steps. Stop all infusions running through the catheter. You may need to disconnect an administration set if all of the ports are being used. Clean the injection cap with an alcohol swab and let the cap air dry. Insert a Vacutainer needle or adapter into the injection cap. Unclamp the catheter. Now place a 5 milliliter blood collection tube into the Vacutainer. The first tube of blood will be the waste. Now insert as many more tubes as you need to collect enough samples for the required tests. For each tube, remove only as much blood as the specific test requires. When you've removed an appropriate amount of blood, clamp the catheter.